Hi, welcome to IPED Session 15 Facilitator Tips video. In this video, we will provide an introduction to the fishbowl exercise with a few demonstrations. For Session 15, teams will practice advocacy and assertion tools in a fishbowl format. A fishbowl exercise is a form of dialogue that can be used when discussing topics within large groups. It allows several or all individuals in a group or team to participate in a conversation. For Session 15, the fishbowl will consist of a standardized caregiver from the CAPE Simulation Center and an interprofessional team with a chosen team leader. Your role as a facilitator will be to introduce the purpose of the exercise, describe the goal, the roles. In this case, the roles are a caregiver from the CAPE Simulation Center, a team leader, and team members. The team leader will initiate the conversation with the standardized caregiver. A team leader can call a timeout if stuck and tag back in, or switch with another team member who might have an alternative approach based on their skills and/or professional background. Team members should practice situation monitoring by paying close attention to the team leader's interaction and be ready to switch. Your role as a facilitator will also include describing the structure. You may want to arrange a circle of chairs in the front section of your room to allow for a more comfortable and authentic discussion. If that is not feasible, the team and the caregiver can form a circle while standing. You should also remind the teams about timing. Each team in the room will get the opportunity to practice. The caregiver will portray different behaviors for each team. After you describe the goal, roles, structure, and timing, allow the teams 5 minutes to review the case, organize themselves, and their approach. Once the teams finish their team task, you will prompt teams to sequentially practice and receive feedback. Instruct the non-participating teams to observe, and you should note successful methods used by each team. Once the last team is done with the role play, you will facilitate a large group discussion by summarizing the successful methods you observed. If you have additional time, you may solicit further observations or comments from teams around the room. It is critical to 1. Recognize the role of students as advocates for oneself and patients. 2. Acknowledge the importance of recognizing the concerns, worries, or fears of patients and/or their caregivers, and modifying the communication approach to specifically address such concerns while ensuring that critical information is clearly addressed. The following interactions provide a visual demonstration of a fishbowl exercise. The first interaction shows a dialogue followed by immediate positive feedback. The second interaction shows an example of constructive feedback. The last interaction shows a handoff to another team member. Due to timing constraints, the caregivers are instructed to focus on 1 to 2 key points in their feedback and provide feedback from the caregiver's perspective, not as a facilitator or an instructor.
So my name is Amy Nordencraft. I'm the physical therapist on our team. How would you like to be addressed?
Just call me Deborah.
Deborah? All right. Deborah, this is Susanna.
Hi, I'm PA.
You're the physician assistant. And Joey?
MD.
Okay. And Carol, School of Pharmacy. So she's our pharmacist. And
Dental care.
And this is Herman.
College of Nursing.
Yes. And this is Dwayne. So, Deborah, I understand you have some concerns about what's going on with Barbara.
Yeah, that's my grandma.
Yeah.
And it's just, I'm very frustrated right now.
Okay.
Because I feel like things are getting worse instead of getting better.
So I know she's been coming here for therapy.
Mm-hmm.
So tell me what's been getting worse at home.
Her pain is out of control.
Okay.
And I feel like we're constantly chasing after the pain, and she doesn't feel good anymore.
Okay.
She's miserable.
Okay.
The medication that she received is not working.
I see that this is very frustrating for you.
Well, it's hard. It's hard to see her in pain.
Yes.
And on top of that, what's happening is it's screwing up with everything else.
Okay.
Her depression is worse.
Okay.
Because she's in pain. She's tired all the time from this drug. And I'm terrified she's gonna fall.
So tell me a little bit more about, because I know she's been walking pretty well here, but tell me a little bit more about the falling piece.
Well, she's tired, right?
She's
so
tired,
this drug
okay.
makes her really, really tired.
Yep.
Vicodin.
Is it also the pain medicine? Okay, so Carol, I'll need you to kind of help with that, and maybe you and Joey can confer on that. Okay.
Yeah. So she's on the Vicodin.
Yeah.
And so all it does is it makes her sleepy and it makes her constipated, but she doesn't feel good.
Okay.
She still is hurting. She complains constantly about the pain.
And is it in the morning or in the afternoon, or like when she leaves to come here? Is it like that in the mornings, or is it more in the afternoon?
It gets worse at night.
Okay.
After she's been moving around, whatever she does here makes it worse instead of better.
Okay.
Then she gets home and she can't poop. So I got that going. So she's complaining about her belly. She's complaining about her hip, and because it makes her so drowsy, I'm terrified she's gonna fall and we're gonna like break the other hip.
Okay.
So we gotta fix this.
So that's a valid concern. So you mentioned that when she was at rehab, the pain was under control. Better?
Yes.
Now, at least my understanding, and I will defer to you guys because I believe she was on Dilaudid in the nursing or in the rehab, the subacute. So we need to, because that is not, Deborah, that is not a typical medication.
But it worked.
It worked.
And can't we just get that back, because she was doing fine on that? If we could just
1 minute left.
that.
So we need to talk about that, okay? So if I'm correct, Deborah, the big concerns are tripping, pains not controlled well, especially at night. It's huge. She's drowsy. She's having some issues with constipation.
Yeah, and I can't leave her alone.
And okay. So, and my understanding is, were you able to before?
Yeah, she was doing great.
She was
before.
okay.
Yeah, I mean, I was there. She needed help with some bathing and stuff like that.
Okay.
But I mean, now I can't even like take a walk, and I'm exhausted because when I'm there, I'm on like 24 hours a day. I'm constantly terrified. If I hear a noise, I'm running into the room thinking she's fallen.
So what we will do as a team, so I appreciate very much you bringing these forward. We need to confer as a team to figure out how we can address Barbara's concerns. Is there some assistance that we could try to help you with?
10 seconds.
This is pretty frustrating for you.
It's overwhelming.
Overwhelming. And is there anything that you think would be helpful? Because it sounds like you did exercise before. So getting her to a place where you could start doing some of your self-care, where you can get back to exercising and doing life.
I would give just to have an hour to take a bath and just relax would be great.
Okay. All right. I hear that, and I will try to figure out. We can try to help with some resources with that as well. Hi. Yes.
Hi. So I'm Deborah. Thank you so much for interacting with me as a team. I felt, is it okay if I share some observations I had? I really appreciated when you listened to my concerns and reflected back what I was saying. You didn't try to get defensive. You consulted with your team to make sure that you were going to prescribe an appropriate medication. But the way you enumerated my concerns and then came up with plans to address each one, well, I felt very, very heard, and I felt that we were going to actually make some progress, that you weren't dismissing any of my concerns.
Okay.
So Amy, is it okay if I share with you just something I sort of observed as far
Sure.
as something I'm going to just maybe encourage you to try? Is I did not hear you actually say a cuss directly, and I could tell though you were thinking about it. I could see that you were feeling there were some safety issues present,
Yeah.
but I didn't actually hear you verbalize that. So I'm wondering if a cuss would be appropriate about my kind of desire to continue the Dilaudid. If there would be a cuss around that might be a safety issue and that you might be uncomfortable with something like that.
No, I think that's a very good point. I think I was trying to say I was concerned. I don't think I did. And I do know that I was uncomfortable for both Barbara and you. And the safety that I truly saw was the fall risk for Barbara, but you're right.
Would you like to try that?
A rewind?
Yeah.
Oh, that would be awesome. Not really, but I'll do it.
Okay, well let's give it a try. So I feel like she's gonna fall if I leave the room.
Okay, so it sounds like or what I'm hearing is I'm concerned about safety, because it sounds like she's a little drowsy, is that correct? And then that she's gonna have a little trouble with being, especially when you're leaving, being safe. And then I'm uncomfortable with the fact that it sounds like this med she's already on is causing her to be drowsy. And now we're talking about a medicine that's even a little more potential for being drowsy. So that's a concern for that. And again, I will hand off to my team because that's not my specific area of specialty, but it sounds like that medicine has several concerns. And we would need to talk about what's the best medicine to keep her safe.
I don't understand, why can't we just go back to the Dilaudid?
So as a physical therapist, the medication is not my area of complete expertise, so I'm going to hand off. I'm going to ask Joey if he can speak a little bit to why the medication might have been changed and what the concerns we have as a team. So I want him to be able to address that.
Okay.